How long is dental implant surgery? Is it painful? Does it hurt? I'm joined by real patients to answer your top 5 frequently asked questions about dental implant surgery. Before we dive in, you may be wondering, what do dental implants cost? Well, to find out, you can download the Dental Implant Cost Guide in the description below. Let's get started with number 1. Toby asked, what is the time frame in the office from beginning to rolling out to the car?
Good question. I think it really depends on what you're there for. For myself personally, I had a full upper and lower put in. So I was in surgery around 6 hours, but it was great. There was like 6 people in there doing, each one had a job that they did. For me personally, I think they went through my nose and in my arm. As soon as I laid back, I closed my eyes. Next thing I opened my eyes, I was done. They were remeasuring things. Everyone was great. I felt fantastic. So it depends how long you're in there to rolling you out to your car. Again, I was in there for 6. If you're just doing uppers, maybe less, So I think it really is a good question to ask your doctor. It's probably easier one for them to answer what that time frame looks like.
Okay, for me, my surgery, it took approximately from the time I arrived to the time I got back home was about 3.5 hours. To me, it was pretty quick. I didn't know necessarily how long I was going to be, but from the time that I arrived until the time I ended up back home, it was before lunch. I did, though, I had my teeth pulled from my top arch, and then I also had teeth pulled from my bottom arch, but I only had implants placed in my top arch. And yeah, so possibly that's why it was as quick as it was.
Okay, let's go to number 2. So Kelly asked, can someone please tell me what I need to do the day of surgery and what I need to have on hand? Or what do I need to buy beforehand?
Preparing for surgery. Well, for me, it was more just making myself at ease, knowing that this is the step I've been waiting for all this time, and just relaxing. Know that when you're done, you're gonna go home. Someone's gonna either, or at the hotel, wherever you're going to. I knew I needed food, so if I backtrack, prior to going to surgery, I had gone and gotten some yogurt. I'd gotten some pudding, some Jello, mashed potatoes. I was in a hotel, so I had mashed potatoes like a microwave. That's what I had to start with. I was actually starving when I was done. So honestly, about an hour after surgery, I went to a ramen place and I just had them sell me the broth, and it was amazing. So I just sipped some beef broth, and it was great. Felt no pain. I was really lucky. I had no bruising at all. That could be because I only had like 6 teeth removed. Mine had already been removed. Even after day 5, I didn't have any bruises on my face. I was really, really fortunate.
Oh, that's amazing.
Or whatever food you think you might want to have afterwards, whatever feels good for you. Some people aren't hungry after surgery. I'm always hungry.
I'd be the same way, I'm sure.
Yeah.
And then what about, medication? Is that something people need to pick up as well?
Yeah, probably, yes. I don't, for me, like stuff like Vicodin, stronger stuff doesn't really work for me. Although, I'll be honest, I did have a prescription for it. I did the ibuprofen, which I really like. You alternate. There was only one, I'm being honest, it was only like probably day 2. I took a half of Vicodin, which really helped. But after that, I'm more of an ibuprofen kind of a guy. It's a little bit more gentle. And I'm kind of allergic to anything stronger than that, so I don't take it. I think mine was they already filled one for me. I went to a pharmacist, they already phoned it in. So you'll be able to film. I already went to Rite Aid and had gotten all my prescriptions before I even went. So they're on it.
In preparation for surgery, I would say it depends upon, are you a travel patient or are you local? So that might vary for the different, reasons as to, how you're accessing Nuvia. But for everybody, I would say make sure that you have prepared food for yourself. You've already gone shopping because you don't want to do that after surgery. When you're thinking about the food to get, you're going to want to make sure that you stick to the plastic fork friendly diet. And so, and even your first couple of days, you may not feel like chewing. And you want to make sure you have something really soft. So like pudding or applesauce, vanilla ice cream, something that, and mashed potatoes, those are all really good. And then moving forward, maybe you want to introduce pasta, Anything, like I said, that you could cut with a plastic fork will be good. Also, you want to create a safe and comfortable space in your house that where you can recover and everything is kind of close by. Also have some, I always say keep a mirror nearby and your phone nearby because you'll always be wanting to look at yourself and your smile. And then, of course, your ice packs. So everything that as it deals with recovery. So prior to surgery, you may, Nuvia is going to give you an ice pack, which works very well. However, some people find that getting additional ice packs, because you do have to rotate them. So while one is refreezing, you'll have another one that you can use. Yeah, and pick up your prescriptions. Don't forget that.
All right, well, let's go on to the next one then. Lisa asked, I was under the impression that you were given your teeth same day as the surgery. After reading a few posts, I'm now thinking that isn't true. They don't put them in while you're still asleep?
No, they don't. They take the ones that you have in your mouth out on the day of surgery. They place the implants on the day of surgery. And then the very next day is when you go back in to receive your new arch and they place them in. And you are awake when that happens. So, one of the cool things about the day of surgery is they also do more measurements for you. So after all of the teeth are extracted, they again go in to make sure that the permanent arch will be fit to your gums. And so they have a team of professionals, not just the surgeons and the anesthesiologists and the prosthodontists, but they also have their own lab. And they take those measurements and they create an arch that's just for you. Some individuals may be used to a process where you get your implants placed and then also a temporary denture might be put in there for them to have as a healing denture or something. However, with Nuvia, it's a different process and they do not provide temporary arches for you. You go back the very next day and you get a permanent arch.
As far as I know, the only other places I've ever heard were places other than Nuvia that did that. So sometimes a person might have to get an alternative method before they get their permanent teeth in. I can't speak to myself on that. I had my teeth put in the next day.
Christine asked, how long were any of you in pain after they removed your teeth and implanted your new teeth? And how bad was the pain?
How bad was the pain? Well, it depends where you are in your life with your teeth journey. At that point, when I went to Nuvia, I only had 8 remaining bottom teeth, 6 or 8, I don't recall. They pulled those. They did them with precision. I didn't feel it. There was no bone fragments. Everything came out. And I think realistically, we have to look at this as there's going to be some degree of discomfort. You can call it pain. You can call it whatever you want. I think we all have to be adults about how we look at these things and realize, yeah, we're going to have to adjust our life a little bit. It's a huge procedure. It's a procedure. Ibuprofen, Advil, those things you can take to help the discomfort for sure. Mine was minimal. Again, like I said, I didn't have a lot. I had one day where it was a little intense because I was very active. I had traveled to go get my surgery and I probably did a little bit more the next day than I probably should have. Totally manageable for sure.
And how long would you say it took for that discomfort to subside?
Probably about 24 hours. Yeah, by the time I got my teeth in, I was fine. When I flew home on that Friday, came on a Monday, flew home on a Friday, it was totally manageable for sure. And then, of course, any discomfort I had, all I had to do is look in the mirror and see my smile. I was like, it's so worth it.
Everybody is different. I can only speak about myself and my pain level. Number one, I have a pretty high pain tolerance to start with. So I really did not feel pain. I did feel some discomfort, but I will say that even though I have a pretty high pain tolerance, I loathed toothache pain. And so that was probably the worst pain that I felt before, was whenever I would have like a cavity or an exposed nerve or something like that. And that pain just shot through my ears and it was always hurt. But with this procedure, I didn't feel anything like that. There was no type of pain for me to speak of. But again, everybody is different. And people experience pain differently. And also everybody has different types of things that they have to go through. As I stated before, like I only have the top arch. So I only had to get my top teeth extracted. A lot of them were already loose. So probably didn't take a lot, to jiggle those out. But in the end, they did still have to place the implants. But the discomfort, I would say, maybe lasted a couple days, but I took the pain medicine as prescribed because I wanted to just stay ahead of any type of pain that might have been anticipated. But I personally didn't experience pain, only slight discomfort.
So, for number 5, another common question we get is, what do dental implants cost? So, to find out the answers for that, you can download the dental implant cost guide in the description below.